So welcome to Pregnancy and Exercise, where we're going to talk about healthy moms, healthy dads, and healthy babies taking care of you. My name's Mary Thomas. I've been a physical therapist for about 30 plus years, and one of my passions is female health. So have you ever noticed how you'll do something for someone else, but you may not do that same thing for yourself? A perfect example of this is when you get on an airplane and they say to you, in the very unlikely event we should have an emergency and oxygen mask drop from the ceiling, be sure to put your oxygen mask on first and then help the people around you. And it's so interesting how we tend to help the people around us, our children, our spouses, our parents even, before we help ourselves. And this is very common. So the exercise part of life frequently gets forgotten because we think it's just for us, rather than thinking that it's not just for us, but it's for those around us in addition to us. And so when we look at it from the perspective that we are all going to have, that we're all going to be able to benefit if one person exercises, mom. But if dad exercises and supports her in it, that's going to add up and compound and combine to have a greater effect on the baby. So let's start talking about some of the pros and cons and some of the things we want to be careful about when we do exercises. So what are some of the exercises benefits before, during, and after exercise? And one of the things that we don't even realize is that when we have a healthy weight, when we have enough weight loss that we're at a healthy level, it actually increases our fertility. And so when we are at a healthy weight, it helps our bodies be at a place where they want to get pregnant and are ready to get pregnant and invite that another extra person, that additional person into the family and into the household. But some things that people don't know about exercise during pregnancy, before, during, and after pregnancy is it reduces your risk of type 2 diabetes by 60%, which is huge. People who get gestational diabetes, meaning diabetes during their pregnancy, have a 10 times higher risk of becoming type 2 diabetic later in their life. But when you reduce that by 60%, you're reducing your entire lifespan of health. So it's very valuable to exercise during your pregnancy. Another benefit is that you start to change your habits. So when you change your habits for the benefit, let's say I'm just changing my habits for the benefit of my baby, I'm also changing my habits for a healthier life, meaning I am going to exercise not just during my pregnancy, but after my pregnancy. And maybe I find some activities and some things that I really love doing, and I teach my child. So I end up developing habits for my life, but also my child's life that are happier and healthier because I'm engaging with them in physical activity. Exercise has also been shown to improve self-image, increase your energy level, and pregnancy is something that tends, your body's doing two things now. It's keeping you alive and doing all the things that you do every day, plus it's growing an entire another being inside of you. So having that increased energy becomes hugely valuable. It also increases your level of endorphins. And if you don't know what endorphins do, they're very valuable during pregnancy because they reduce pain levels and make you just feel better and happier. Exercise also increases and improves your sleep. And sleep is not something that is excessive usually during pregnancy because it becomes very difficult to sleep. So the more you exercise, the better your sleep is going to be. But it also increases the stable and peaceful emotional state due to the increased serotonin and dopamine levels in your blood that happen when you exercise. And so there are a lot of benefits of exercising, and some people are like, oh, you're pregnant, you should sit down, put your feet up. I don't really agree with that, and neither does research. Movement and being healthy and staying active during pregnancy is so important. So what happens if I do just sit down, put my feet up, and I don't really participate in life? One, I get a loss of muscle tone and fitness level. So with the loss of muscle tone and fitness level, because I'm like, well, I'm pregnant, I have to be careful of the baby. In most cases, you are way better off exercising unless you have some specific complication, which we're going to talk about here in a minute. Also, excessive weight gain during pregnancy makes for more difficult deliveries, as well as the possibility of preeclampsia, as well as the possibilities of having difficulties with gestational diabetes. And after you give birth, then you have to take all that excessive weight gain off. So it's better to really watch your weight and do things to keep your weight gain at a reasonable level. I've already talked about the gestational diabetes. So higher risk and higher severity of high blood pressure, constipation, and back pain. I mean, almost every pregnant woman discusses these issues at some level and some degree, and so being able to keep those things at bay and keep them at a lower level during pregnancy through exercise. Also, if I don't exercise, I might have more difficulties with emotional highs and lows, which might cause some relationship issues. So it might be really helpful to engage in those exercises. Also, low self-esteem leads to depression, and that also can affect your baby. So by having exercise, you can improve those things, improve the ability of your baby to, actually research has shown it improves the ability of the child to handle changes in their environment. That study actually talked about children who were up to 5 and 6 years old having improved ability to handle changes in their environments, and if they had an exercising mom during pregnancy. So, and then more difficulty during delivery because your muscles aren't as strong and they're not as prepared to deliver that child. Okay, so let's talk about some absolute contraindications for exercise. These are rare or fairly infrequent, but they do happen, so we need to talk about them because these are reasons that it's like pretty much it's a no exercise for you. Sorry, you're going to have to be more aware of your dietary intake, and just know that that's going to be something you have to be aware of. So if you have a significant heart disease of some type, if you have pregnancy-induced high blood pressure, which is not managed because you're already later in your pregnancy and you've already gotten the high blood pressure. Usually that starts like in the 3rd trimester. So restrictive lung disease such as asthma. So I can't get good breathing. As the baby gets bigger, it becomes more difficult to breathe because the baby's taking up space that your lungs need, aren't able to expand. So if you have restricted lung disease, that can also reduce your ability to exercise. An incompetent cervix. If you have that, you will probably know it. And that is an absolute contraindication for exercise. So if you have twins or triplets, multiple babies, then that's also a contraindication because you don't want to have that much weight of all of those babies being pushed down on your cervix. So episodes of premature labor with this pregnancy. So if you have had early contractions and the doctor has said, you're having premature labor, then that's a reason not to exercise or to stop exercising if you are. Ruptured membranes. Again, this usually happens later in the pregnancy and usually from high impact activities. So if you have ruptured membranes, it's a good reason to stop exercising. Most of the time, again, that's later in the pregnancy. like second and third trimester bleeding. Uncontrolled type 1 diabetes. Exercise can actually help control blood sugar in controlled and monitored diabetes, and then uncontrolled thyroid disease. And as with any exercise program, you need to talk to your medical healthcare team and obstetrician prior to starting an exercise program. So relative contraindications. Relative means it depends on how severe they are, and it depends on how they're affecting you and what is being done to address these issues. So anemia, that's where you have low iron in the blood, and severe anemia where can cause just a lot of fatigue. And so taking actions to address the anemia can resolve that issue. Uncontrolled maternal, meaning mother, cardiac arrhythmia. That means the heart is either beating too fast, too slow, it's not beating regularly. And again, a lot of times that can be controlled with different dietary considerations and diagnostic procedures to figure out what's causing the arrhythmias. And once it's controlled, then you can resume exercise. And some physicians will even have people exercise for that. So mild to moderate cardiovascular disorders, again, heart issues. And I had said this earlier that these are fairly rare. So chronic bronchitis or asthma. Being a heavy smoker, in my opinion, that's a relative contraindication because you can control smoking very easily, or maybe not very easily because it's very hard to quit, but finding a way to reduce how much you're smoking so that you can, one, provide more oxygen to your baby because the baby is getting the smoke. So to really reduce the smoking level would be my first suggestion. Not to stop exercising, but to change how much you're smoking. Mild to moderate respiratory disorder, and again, that would be like asthma, chronic bronchitis, and those things just have to be, are they under control? Are they being monitored? Are your healthcare providers involved in the monitoring and control of that, being being advised that you want to do exercise, and also are they, encouraging you to exercise? Most conditions, honestly, with respiratory and lung issues and heart too, most of them are actually improved with exercise. So if you have a history of extremely sedentary lifestyle, then you need to start very gradually and work up. You don't just say, well, I'm pregnant, I better start exercising. You want to start gently working up in your exercise program. Extreme obesity or being underweight, malnourished, or having an eating disorder are also relative contraindications because it might be that someone needs to get help for these issues and address them so that they're able to support the baby in being healthy, because they're usually underlying issues that contribute to extreme obesity and eating disorders and malnourishment. And so to get with someone who can help you with those issues and do an exercise program that is appropriate to those needs. So an intrauterine growth restriction in the current pregnancy. So again, that would be something you need to discuss with your current healthcare providing team. Previous miscarriage or preterm birth, and twin pregnancy after 28 weeks. So again, when the babies get to a certain weight, you're going to have to keep in mind that you're going to have more weight happening in your uterus and inside your body, so the exercises are going to need to be reduced or even eliminated at some point. Poorly controlled type 1 diabetes, hypertension, preeclampsia, seizure disorder, thyroid disorder, orthopedic limitations. All of these things are relative contraindications, because exercise can help bring these things under control with a program that encourages inclusion of what's my dietary program look like, what are my what is my weight, what are my goals of the exercise, and how can I integrate these things so that it becomes an overall picture rather than just looking at one thing like exercise. So in those types of issues, you need to include the entire picture to make your decisions. So general recommendations for exercise during and after pregnancy by the American College of Gynecologists Committee said that exercise during pregnancy and in the postpartum period should include both aerobic. So aerobic exercise is an exercise that makes your heart and lungs work. And so that's like swimming, walking, riding a bike, although I'm not necessarily a big fan of riding bike for pregnant women. My favorite one would be walking for pregnant women. Strength training is also important after medical clearance. So they are recommending 30 minutes of exercise on most, if not all days, for women with uncomplicated pregnancies. The Australian group of gynecologists recommend a total of 150 minutes of exercise per week. So that would be 5 days a week. You're doing 30 minutes a day. And the American College of Gynecologists just said that they recommended 30 minutes most, if all not. So to me, 5 days a week is most days. And, I think there are a lot of lifestyle changes and a lot of things going on during pregnancy. And so to not get down on yourself and say, I made it 4 days this week. Woohoo! That's more than nobody. It's more than not exercising at all. And so celebrate when you've done something. Don't say, well, I didn't get my 5 or 6 days in. Go, oh, wow, you know what? I still got this many minutes of exercise in, because if you're consistent, and so this week you only got 4 days, and the next week you got 5 days, great. Celebrate what you get done. Celebrate that you're taking care of your body and your baby and preparing for the delivery and preparing for motherhood by doing those things. The other thing they recommend is that exercise should be perceived as mild to moderate. And you can do a Google search for the Borg rating scale. There's a lot of them out there. But it's how hard do I perceive that I am working during the exercise. So if I cannot have a conversation with someone because I'm walking so fast or I'm jogging so hard, then that is above a moderate level of exercise on that scale. So do a Google search, look for the Borg rating scale of perceived exertion, and just do your best to stay in where you feel like a mild to moderate would be healthy for your body, because I'm moving, I'm getting going, I'm getting my blood flowing, but I'm not overdoing it to the point where I'm taxing my body beyond the point where it's safe. So another thing during pregnancy that becomes even more important, it's hugely important even if you're not pregnant, but it's even more important when you are pregnant. A couple of reasons why. One, a lot of pregnant women are like, I don't want to drink too much because then I'll have to go to the bathroom. And because there's frequent urination with going to the bathroom. The truth is that when the water that you're excreting in urine is the correct pH, you will have to go to the bathroom less frequently because it's not irritating the inside wall of your bladder. So having the appropriate amount of water in your bladder so that it's the right pH and it's not real acidic because you're not withholding water is super healthy. And another thing when you're hydrating your body is to remember that half your body weight in fluid ounces every day is the appropriate amount. And this becomes really important for pregnancy. Now, I recommend that to everybody, half your body weight in fluid ounces. But during pregnancy, you got 9 months where you're gaining, about 30 pounds on average during those 9 months. And so your water intake, as that baby gets bigger and is sitting on your bladder, you tend to drink less water, but you actually need to drink more, because that baby is so important to your body and its growth and development. Your body will take water and give it to the baby, and it will take it away from you. And so then you get brain fog, and you also get swelling in your tissues. Why? Because your kidneys are going, oh my gosh, we don't have enough water, because so much water is going into the baby to keep it healthy and growing, that the kidneys start saying, we better conserve every molecule of water, and you actually have more issues with swelling. So when you drink an appropriate amount of water, you will have less swelling. Your bladder will actually be more comfortable because it won't have acidic urine in it. It'll have a neutral urine in it. And you can include some electrolytes with that. I don't encourage people to drink the sugary sports drinks, but they have a number of sports drinks out there now that are like fruit juices or have minimal amounts of sugars in them, but still have the electrolytes, because those electrolytes are absolutely essential for cell division to grow that baby and to keep you healthy during the pregnancy. So drinking enough water and staying hydrated is absolutely essential. And then keeping your eye on the goal. Goals needs to be the focus of maintaining good fitness during the pregnancy. Okay, so you're not trying to reach a peak performance level or training for a competition. You need to choose activities that will minimize the risk of loss of balance or falling. So like I said, I don't really recommend bike riding because there can be a risk of falling with that. And then adverse pregnancy or neonatal outcomes. There's actually an increase of adverse pregnancy and neonatal outcomes for people who are not exercising. So it becomes super important to do those exercises and to keep your eye on the goal, which is I'm staying healthy and I'm doing what I need to do to keep my body going. I am not, trying to prepare for a competition or to look like Barbie the day after I deliver a baby, because it's not realistic, number one, and number two, that's not why we exercise during pregnancy. Okay, so what kinds of exercises are best? Well, there are a few questions I ask people, and one is, what type of exercise and activity was I doing before I got pregnant? So if I wasn't doing anything, I can still start exercising during pregnancy. I just need to start a little slower and more gentle. If I was doing it before I got pregnant, then I may want to cut down that first trimester by 20%. And the second trimester, I might want to cut down by another 10 or 20%. And by the third trimester, I may even want to evaluate if I want to change exercises depending on what I was doing, like rock climbing, horseback riding. I don't recommend those things after you become pregnant because the risk of falling is too high, and you do not want to fall. So another really important thing is, how aware am I of my body? Because if I'm highly aware of what I'm feeling and I'm able to say to myself, okay, my body is telling me right now to stop. This is as much as I can handle at this moment in time, then I can probably push myself a little bit harder than I would encourage somebody to push themselves if they're like, I don't have a very good awareness of my body. A friend of mine she was delivering twins, and And she kept saying, I will pay somebody else to do this for me. I will pay somebody else to do this for me. And afterwards she said, it was a real eye-opening experience of how unaware of my own body I was, because the medical people would ask me to do things and I had no idea how to do it or what I was doing. And she said, I made it through the delivery, and I swore that for my next experience, I was going to be much more aware of my body and what my body was feeling, and how I could utilize it as a partner rather than as this, oh my gosh, I got to deal with this thing and make it work. So what kind of activities do I enjoy doing? Because if I don't enjoy doing it, I'm probably not going to do it, right? And again, I've mentioned this before, where am I at in my pregnancy? If I'm in my 3rd trimester and I decided to come to this, listen to this webinar, I would probably encourage you to say, walking might be my best and only choice at this point if I'm just starting something. And that's okay, because, you got to start somewhere. And you do the best you know until you know better, and then you do better, right? That's what Maya Angelou said that. And so if I'm later in my pregnancy and I go, oh, but I might be able to gain a little bit of strength and endurance and practice some breathing activities before I deliver, it's not too late to start. So consider all of these aspects before you say, oh, this is exactly where I'm going to start, or I can do exactly these things today. All right, and I put this slide in because I figured y'all could take a screenshot of it or look at it, because these are actually target heart rates for people at different age levels in pregnancy, where you're doing aerobic exercises like walking, swimming. Again, if you do a stationary bike, I'm okay with that. I'm not a big fan of street biking if you're pregnant, because there is a high probability of falling. Elliptical machines and low impact dance with minimal twisting, and definitely low impact. So to do these different activities, what do I like and what do I feel I would be comfortable doing? And like walking's pretty easy. You can probably do that in your neighborhood or around where you live or around where you work, where you might not know where to get into a low impact dance class and don't want to join a gym. So pick an activity and note your age and your heart rate where you want to get that target heart rate while you're doing aerobic activities. Stretching activities. So let's talk about relaxin. It's a hormone. Relaxin is a hormone that literally relaxes your connective tissue, meaning your ligaments and your tendons. Those are the parts that hold your joints together. So when it comes to stretching, I encourage people to be a little on the conservative side. I read a number of articles about preparing for this, about, do yoga, and I'm like, I'm not necessarily, if you've already been doing yoga before you got pregnant, and then you decide to do yoga as in the early part of your pregnancy, maybe the early half or so of your pregnancy, but as that relaxin hormone level goes up, because it helps your body be able to stretch and allow the growth of the baby, it also helps your pelvis open up so that you can deliver the baby out through your pelvis. And so if you're doing yoga like yoga people do it, because I've taught yoga, and I'm really trying to stretch and push into the end of range, it becomes easy to injure or cause a problem with those ligaments. So my recommendation is, if you're really good at yoga and you've been doing it, to not push into the end of range of motion like you typically would do in a yoga pose. You would go to the best of your ability, and then you'd say, okay, I'm going to stop right there. And I'm not going to breathe and try to go as far as I possibly can. And that's true for any stretching activities. Stretching is okay, and it can be helpful, especially if you're feeling tight in some areas, but you don't want to go overboard during pregnancy and stretching, because you can end up stretching too far and actually causing injury. And I think it's super important for pregnant people to know about that, and to realize that it's like, listen to your body. That is so crucial when you're doing exercises. So light weights, or for strengthening, it's recommended to do light weights with high repetitions. You want to stabilize your body using correct body positions, which will engage the correct muscles. So I'm going to talk for just a second about the transverse abdominal muscles. So the transverse abdominal muscle goes from side to side. So it hooks from your rib cage and goes across to your other rib cage. It hooks from your pelvis and goes across to the other side of your pelvis. And if you're pregnant and you do a light contraction of this transverse abdominal muscle, what happens is it's like you're hugging your baby. You're pulling that baby into your body. That muscle is also, it's a really good core stabilizer muscle. Research is currently showing your core stabilizer muscles aren't the abdominal muscles that we have thought that they were. They're actually your shoulder blade muscles that pull your shoulder blades down towards your butt cheeks and in towards your spine. Your transverse abdominis, which pulls your rib cage and your pelvis together. So again, it's like giving your baby a hug, and then your pelvic floor muscles automatically lift up. Now, I have heard and seen and read various information about pelvic floor muscles. Some people say that you should do lots and lots of strengthening of the pelvic floor muscles during pregnancy, and I honestly disagree with that, because, and there is literature that disagrees with that, because the baby those muscles have to open up, and the baby has to come through your pelvic floor muscles in order to be born. And so I need to both be able to relax and contract my pelvic floor muscles appropriately, and with my thought processes, I need to say, okay, can I actively contract my pelvic floor muscles and lift them up? And then can I consciously let them relax and just open up? Can I let them open, my pelvic floor muscles, while I contract my transverse abdominal muscle and hug that baby into my body? So to be able to coordinate those two different movements with your exercise, and weightlifting with light weights is a good way to say, can I lift this weight and my muscles are going to contract, my pelvic floor muscles and my transverse abdominal muscles are going to contract, and then when I release the weights, can I relax those muscles and really feel that relaxation in my pelvic floor muscles? And while they're relaxed, can I then go ahead and contract the transverse abdominal muscle, hugging the baby into my body? Being able to contract those muscles and relax those muscles individually can be hugely helpful and valuable, because if I need to relax the pelvic floor muscle to let the baby be born, but I'm going to have to use my transverse abdominal muscle to help to contract and push the baby out. So being able to know how to do those things separately can be hugely valuable, and doing that with light hand weights can be helpful. So these are some exercises that are what I call your rescue moves. Because pregnancy involves pain. Why? Because your relaxin hormone is allowing things to stretch apart and open up. And because things are stretching and opening, you can get some discomfort in different areas of your body. Plus, your body shape is changing dramatically. Your breasts are getting enlarged. your stomach's getting enlarged. And so you can get back pain, which the cat and cow, which is a very common movement where you get on your hands and knees and you arch your back up to the ceiling and then you drop your stomach down to the floor. That's the cow part. The cat part is arching your back up to the ceiling, and then the cow part is dropping your tummy down to the floor. Then you have hip flexor stretches where you can stand with your feet about hip width apart, and you're bringing your pelvis forward over your toes. You should feel a stretch in the front of your pelvis that can even come up underneath and behind the baby inside your body. But opening up your hip flexors can be hugely helpful as well, because the baby's sitting on these muscles. And by helping to stretch them, you can increase the circulation in those muscles. So the hip adductor stretches are like sitting with your legs. You sit on the floor with your legs spread apart, so the inside of your thighs feel stretched. And you can do this one leg at a time. You don't have to do it two legs at a time. And just open up your hips by opening up your legs and stretching them apart. The pill bug stretch, I have people just wrap their arms around their bodies, so like one hand goes on the back of each shoulder, so you're giving yourself a hug, and then you just roll up, pushing your breastbone. You're not actually pushing your breastbone, you're thinking about pushing your breastbone back through your spine as you roll down a little bit. Depending on where you're at in the pregnancy, you're not going to roll down a long ways. But this helps to stretch some of the shoulder blade muscles, which can become fatigued and overwhelmed because the breasts are becoming heavier as they're preparing to provide milk and nourishment for your baby. So do some stretches there as well. So the prayer in pockets movement, you're going to start with your hands together in front, kind of in that prayer position, but you're going to exaggerate it. So you're going to hold your arms together clear down to your elbows. And then you're going to hold them together as you raise them up over your head. Reaching, 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 reaching all the way up over your head. So as you're doing that, you're feeling a stretch with your shoulder blades. And now I'm going to pull my elbows back behind my shoulders, bending them as though I was going to slide them into my back pockets. And really pinch them down in there. So that helps to stretch my chest, which frequently during pregnancy, as the breasts get enlarged, your chest can kind of feel like it's getting shortened and tight. And so it diminishes your breathing capacity, as well as causes you to just feel like, it's just so much work to breathe. So when I do the prayer in pockets, it helps to stretch both my chest muscles and my upper back muscles. And then the pelvic floor muscles and pelvic floor movements are both rolling you can do this sitting in a chair, but just rolling your pelvis forward and backwards. And then doing some breaths. So as I breathe down deep, I feel my pelvic floor expand and stretch into the chair or surface that I'm sitting on. And then as I exhale, I do a gentle little lift. And then as I inhale, I notice the ability to relax those pelvic floor muscles and how they can stretch into the surface I'm sitting on. And then gently lift them up as I'm exhaling. So knowing how to contract and relax the pelvic floor muscles can be hugely helpful during delivery as well, because it helps those muscles open up so the baby can descend through them. So before I take questions, and now that you know the importance of exercising before, during, and after pregnancy, What are you thinking about getting started with balancing your body and starting to do some movement with your body? So, for those of you who are joining us today and who are watching this recording, you basically have two choices. You can go at this alone and try to figure it out, or you can be supported and coached by somebody who has already helped over 7,000 people lead healthier, more pain-free lives through movement. So if you're here with us today, would you please type a 1 or 2 in the comments? So I want to talk to you about a program, a system basically that I created that allows me to fulfill my passion for helping people and for helping as many people as possible. Because the truth is, I was never able to have children. I wanted to have children, and due to some medical situations, that wasn't a possibility for me. And so I began to look for what my mission in life was, because, I thought I was going to be being a mom. I really did. And I was guided to know that my mission was to help moms feel better so that they could do all of the things that they need and want to do as moms. So I developed a system that I call the Body Power System, which helps people to integrate their bodies and all of their parts so they become more aware of their bodies, and through movement activities, preparing you to get ready to do all of the things that awesome moms do. You need to build strength, flexibility, balance, and endurance, because your family and the world depends on you to make these things strong, flexible, and balanced. So let me introduce Victoria, who is a woman that I worked with, who asked me if she could get back to work in 3 months, and if that was realistic, and I was like, yeah, it's realistic. So we used Body Power System and took her through that, and she had had some complications that were neurological, and so we were able to get her back. She did get back to work in 3 months. So Jan was a gal that I worked with who I actually had been working with for a while, doing some things that I wanted to have her start the Body Power System. It only took me about several years to get her talked into the Body Power System, because she wanted to just lay on the table and have me fix her, and I kept explaining all of these things about exercise, and finally one day she agreed to do the Body Power System. And then she was like, oh my gosh, I should have started this sooner, and she was really amazed at the changes that she experienced as a result. And this is another person that I worked with who had been having some heart issues, and so she said she didn't even realize she had physical issues, but felt like through prayer that she needed to come into physical therapy. And so when I started working with her, I actually saw some of the issues that were going on with her heart and her rib cage that were out of balance. And as a result, she began to be able to reach out to more people in her circle of influence and help them. And she said, I probably wouldn't have been aware of those people, I don't think, had I not been able to start opening up my rib and thoracic cage in my heart. So the Body Power System goes way beyond just the basic bottom line principles of exercise. It actually really does integrate the body and its parts, while it's also increasing the individual's ability to connect to their own body. And until we're really truly connected to ourselves, like we have our own oxygen mask on, we're connected to what we need to do in our own lives, it becomes difficult to really serve others in the way that we can and that we want to. So the body's power system is perfect for women who want to stay fit during their pregnancy. It's based on normal functional activities that we do every day, so it's not anything extreme. We are exaggerating movements that we do every day in the body power system so that we can allow our bodies to communicate information with us. It can reduce complications during pregnancy and delivery because exercise reduces those complications, and being able to be aware of our bodies reduces those complications, because when we're aware of our body and we know what it's communicating with us because we practice that through movement and through activity, we're able to employ those lessons and that information. And and after delivery, we need to reintegrate all of the body parts that got kind of pushed into dysfunctional or abnormal positions and postures during the pregnancy, and bring them back into healthy positions and relationships, because that makes us more able to take care of the baby and take care of jobs and families and all of the things that we have to do after the pregnancies. So if you think you might not have time to exercise, this actually, you watch a video once a week, which takes about an hour, and then you exercise a couple of times a day for 10 minutes. Plus, I really encourage you to do the Ramp It Up walking program for another 20 to 40 minutes, so that you're going to be getting that exercise time that is recommended by the American College of Gynecologists. You're going to be getting that time in every day nearly. So this is also an easy to follow program. So if you've never exercised before, this is one step at a time, very gradual, progressive, working through learning how to exercise and learning how to listen to your body. And you are guided every step of the way through that experience with videos and worksheets that you can print out. The only equipment you need is a wall and a chair, and pretty much everybody who has a dining room in a house has a wall and a chair someplace. So the body power system is built with your lifestyle and experience in mind, and it's built with being able to gradually go through bodily changes as your body changes, going through pregnancy and then recovering from pregnancy. So one-on-one sessions are available with me for those of you who want a consultation before starting or during your journey. You can write the information in the text. I'm just going to say my phone number, I guess, right now. The office phone number is 214-225-8530 if you want to do a consultation. I do consultations on Zoom, and I have worked with people all over North America and Central America. You have to speak English, though, because that's the only language I speak. Okay, so what does the body power system include? 7 levels of mind-body integration therapy, 14 step-by-step instructional videos, bonus slider levels for the feet and the pelvis, as well as the lymphatic drainage videos. Now, lymphatics are really, really valuable during pregnancy because progesterone changes kind of the fluid balances in the body, which again contributes to swelling. So being able to work on your own fluid systems in your body helps to reduce the swelling and keep your immune system functioning really healthy. You get the phase 1, 2, and 3 movement guides for all 14 levels. You get to learn how to reduce the normalization of the abnormal movement patterns. And again, that sentence might not make entire sense, but as you do the system, it starts to make sense. You're connecting healing energy with the body power system. You're getting contralateral training using your best sides and your best movements. So one of the beauties of the body power system is we put the focus on your best movements and your best abilities, and we expand what's already great about you or already good about you, and we expand those so big that the dysfunction just becomes less and less and less dysfunctional. So instead of beating up what you think about yourself as dysfunctional or not good enough, I actually know that there's great things about you, and this system helps you to pinpoint the great things about you and use those to expand. So there's also creative substitution training. So if you're like, well, I'm probably not going to fit the exact protocol, there's training on how to create your own substitutions and creatively work with your body. There's also some emotional release training. There's also how to score your improvement formula and a video on how to use that so that you can actually measure your improvement at the end of every session. There's an internal structure of integration training and lifetime access to the Body Power Systems community, which enables you to ask questions of other people to hear their experiences, as well as I will be in that community and able to respond to questions. So in the comments, there is a place to, or there is a link that you can link and go, and there's more information about the Body Power System, and you can sign up for that. If you would like to ask questions, I will do my best to answer any questions that you have.